Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode, I'm going to be showing you how to perform lymphatic massage drainage of the breast if your breast has become swollen either during breast cancer treatment or following breast cancer treatment. So if you enjoy this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, which is completely free, and leave a comment in the section below if you'd like to ask me any questions about lymphatic drainage massage, particularly of the breast, or any other topics around breast cancer. So without further ado, let's get into this video, how to perform lymphatic drainage massage for breast swelling. So the first thing I just want to talk about before I get into the massage technique is, when does breast swelling typically occur if you've gone through breast cancer? So the most common times I see breast tissue swelling is sometimes after surgery. So occasionally you can have a situation where if someone's had a lumpectomy, they can have post-operative oedema. So the word oedema, which I'll use a few times throughout this video, is really referring to general swelling, and particularly in this case after surgery. So we're not actually talking about lymphedema here, we're talking about post-operative swelling, which is also known as edema. The other time I can see swelling of the breast occur is when patients have gone through radiation, so either during radiation or following radiation. So again, I don't necessarily classify this type of swelling of the breast as lymphedema straight away. Sometimes what happens is patients will go back to see their surgeon or their oncologist and they'll say, my breast is swollen, and the medical professional will tend to say, oh yep, you've got breast lymphedema. And that can tend to scare the patient a little bit because they think, oh my gosh, I've heard about lymphedema, and this is really bad, this is permanent. But in the majority of cases, when swelling first presents, that's your window of opportunity to reverse it. Now, you know, that doesn't always happen, unfortunately, but at the end of the day, a lot of the time when you first see swelling, it could be classified as oedema rather than lymphedema if it's of the breast and you've just gone through either surgery or radiation. So yes, it's definitely time to act on that swelling, but whether we actually classify it as lymphedema at that point, I tend to disagree that we classify, you know, acute swelling, so swelling that's been around for less than 3 months, as lymphedema, because I think sometimes it's bad to do that because the patient then thinks, well, this is permanent, why should I bother doing anything about it, rather than, okay, I've just noticed some swelling, this is oedema, and I can act on this and get it treated. I just also want to put a little point in here, guys, about when to seek medical attention if you do experience swelling of your breast, because a lot of the time when you get a swollen breast and you're going through breast cancer surgery, it's most likely going to be a normal side effect of treatment. However, if you get a swollen breast, it's not a bad idea to just go and see either your breast surgeon or an oncologist, particularly the oncologist that you're dealing with at that point in your treatment. So if you're going through chemotherapy and your breast was to swell, you would probably go and see your medical oncologist. And if you're going through radiation and your breast swells, you'd probably go and see your radiation oncologist. If you're following treatment and you haven't been in contact with your medical team for a while, I would at least go and see your local general practitioner or GP, and they may redirect you to your breast surgeon or oncologist. At the end of the day, I think it is sensible, if your breast swells unexpectedly, to go and seek medical advice. The reason I say this at the start of the video is not all breast swelling is for the same reason. Sometimes people just get breast oedema as a traditional side effect of treatment, such as radiation or surgery, but there can be other reasons your breast might swell. And 2 reasons that I would put in this video that are really common would be, 1, a seroma. So that's where you can get a trapped pocket of fluid that needs more specific, you know, diagnosis and treatment than just what I'm about to show you how to perform drainage in this video today. But then, you know, recently I've had patients who've had haematomas in their breast, That more often will present as bruising after surgery. So if you have a small hemorrhage following your surgery and you get bruising of the breast following the surgery, most often that becomes what we call a haematoma, which is a collection of blood in the breast. But just recently I had a patient who presented with absolutely no bruising and a very firm swollen breast, and it ended up being a haematoma. So if swelling in the breast is unexpected, and particularly if it's following treatment or there's been a time delay between you finishing treatment and you getting swelling, it's definitely encouraging to go and see your medical team and just make sure that the type of swelling you think is occurring is actually what is occurring. The other reason it's good to get breast swelling checked out is just also in case there is suspicions of infection there. Now, if you've got an infected breast, or if the breast tissue is becoming infected, there's usually other signs and symptoms that we can attribute to an infection, such as redness of the breast. You might have the general feeling of being unwell. So you might have a temperature, you might be getting chills, and you just might be feeling that the breast is becoming sorer than it has. Infections can, rumble along slowly sometimes, but sometimes they can also hit you really quickly. So if you have any suspicion that you might have an infection of the breast tissue, that's another reason where you would go to your medical team and say, hey, I've got a swollen breast, but they might be also asking you about other symptoms. And if you've got any signs and symptoms that come under the banner of infection, then that definitely needs medical attention as opposed to just physiotherapy attention. Okay, so let's get on to how to perform lymphatic drainage of the breast. Now, the first thing I want to really stress to you guys is that this information I'm about to present is based off one of the most recent studies that's been done. The reason I want to share this information with you is because this is the first study of its kind which has used a diagnostic tool that really hones in on how lymphatic drainage works for each individual person that they assess. It's called ICG lymphography. Now, you don't necessarily have to know what that means, but I am going to put this study in the description bar below so that if you want to go and have a look at the real in-depth detail of this study, that you can have a read of it. But it's a fantastic study that was recently done through Macquarie University in Sydney, Australia. And as I said, I'll put the link below so that if you want to go into the really hardcore details of this research, then it's there for you. So first of all, let's talk about direction of how we should perform breast drainage massage. So the first thing I should mention though is from the study that I've mentioned, the drainage pathways of breast tissue change if you have had axillary lymph nodes removed. Now, for the large majority of patients who go through breast cancer, it's highly likely that you've had at least one lymph node taken, if not more. So what happens normally, so with normal breast tissue, if you were to get a swollen breast and you had no lymph nodes removed, you can drain your breast. Say if we've got a swollen left breast, you normally would be able to drain that breast out to the armpit on the left side. In a similar fashion, if you'd had a swollen breast on the right and you had no lymph nodes removed on the right, you could drain the right breast to the right armpit. However, what this study has found is that if you take lymph nodes out of the armpit, then the breast no longer drains to the same side armpit. Instead, in the majority of patients that they studied, they found that the drainage pathway changed from what would normally be to the armpit to going into either the sternum, which is the breastbone, or the clavicle, which is your collarbone, or in some patients, but not as many as most, the breast could also drain to the opposite armpit. Okay, so I'll just go over those three things again. So ultimately, if you've had lymph nodes removed, you shouldn't really find that you can drain fluid from your breast out towards the same side armpit. It's either going to be best drained towards your breastbone or up towards your collarbone, or it can be drained across to the opposite side armpit. So I just want to mention that that's the direction we want to push our massage in when we're draining the breast, because the majority of patients who are probably watching these videos have most likely had at least one lymph node or more removed. Let's secondly talk about the pressure of the massage. Now, again, I have been using firm pressure for some time to drain breast tissue that is swollen, because the research, again, that has been done by people in Australia has found that the pressure that is applied in lymphatic drainage massage of the upper limb is more effectively performed with firm rather than light massage. So I'll just leave a little card to one of the videos I did recently, which is talking about how has self-lymphatic drainage changed. Now, to my knowledge, everybody, I don't know if they've actually performed the same studies on pressures as far as breast lymphedema or breast oedema is concerned. So from my clinical experience, I have way more effectiveness with firm pressure rather than light, whether it's on the arm or the breast. But I'm also leaning on the research that's been done in the upper limb and applying it to the breast, because certainly we know that if you perform light massage, you're not doing any harm. And I have found absolutely no harm by doing firm pressure, but I've certainly found it's more effective to apply firm pressure when you're performing breast lymphatic drainage massage. So yeah, so basically there's probably not been any research done at this point that I can find on what is the best pressure to apply. It's certainly safe to apply light pressure. I see that it's safe to apply firm pressure to the breast for, removing breast oedema. But if we lean on the research that is, following on from what they found in the upper limb, then we can apply that probably quite safely to the breast. I certainly haven't found any untoward reaction from applying firm pressure to breast edema. As far as frequency is concerned, I really stress to my patients that once a day massage is probably ideal, because if you are doing firm pressure with your massage, then if you're applying that massage more than once a day, it's more than likely you're going to end up getting sore from doing too much massage. So I would rather my patients perform their massage once a day for 5 to 10 minutes, but aim to do this 6 or 7 days a week, because the frequency of the massage is really what I'm pushing on my patients. It's that the way the lymphatic system works is that it's best drained frequently rather than too much, which too much is going to make you sore. So I much prefer people to do it once a day rather than 2 or 3 times a day and only last a couple of days and get a really sore breast from doing it too often. So if we just run through how we would perform this massage, essentially I encourage my patients to use whatever hand they feel is most comfortable. Unfortunately, when you perform massage on your own body, it's definitely nowhere near as easy as a therapist performing on you, or a trusted person performing on you as well. So don't worry if you feel like you can't be as effective as, say, your therapist can be when you perform this massage on yourself. So whatever way you can perform it best is fine. Generally speaking, say if I've got edema or lymphedema of the left breast, I would normally suggest to my patients to use their opposite hand. So if it's left breast swelling, I suggest they use their right. And I usually suggest they pop their arm on the back of their head if they can, or even on their shoulder, just basically get the arm out of the way, and then start by pushing fluid in from the base of the breast in towards their sternum, and then also up towards their collarbone. So I'll just move back a little bit so you can see this a little bit better, but ultimately up and in are the 2 main directions that I recommend my patients to go based on the results of this recent study, which use this ICG lymphography, which is really the top-notch technology we've got to assess lymphatic drainage pathways of, anywhere in the lymphatic system at the moment. So just keep in mind, of course, that if this doesn't feel as effective as it could, there is the option of draining towards the opposite armpit. So again, this pressure can be slow and firm, but ultimately I find that using the opposite arm, starting from under the base of the breast and working up into your sternum or breastbone, and then working up towards your collarbone is really the best first directions to try. And then of course, if you need to, you can work across to your opposite armpit. Thank you so much for watching this video. I hope you've gained some really great information on how to perform lymphatic drainage massage for breast swelling. If you have any questions about this topic, please leave a comment in the section below. Look out for my video, which comes out next Tuesday, and I hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.